My name is David King, and I'm the director of the San Diego Imperial Valley High Intensity Drug Trafficking Area. It is my pleasure to welcome everybody here to the HIDTA. I'd like to also welcome you to our event. We're grateful to our community partners, Rady Childrens Hospital San Diego Association of Governments, and of course the San Diego County Marijuana Prevention Initiative. Today, we are here to discuss key findings from the 2022 HIDTA Marijuana Impact on California report. Every 2 years, the San Diego Imperial Valley HIDTA puts together a comprehensive report on marijuana's impact on the state of California. 2022 was the year that we put all the findings together. In 2016, California legalized recreational marijuana, which allowed a variety of marijuana-infused products to become available, including candy, gummies, cookies, and drinks resembling everyday foods. These products can be colorful and sweet tasting, often containing high amounts of THC, tetrahydrocannabinol, that when consumed by a child can become a health emergency. Our data shows an increase in exposure cases both nationally and here in the state of California. Between 2016 and 2021, there's been a greater than 2,000% increase in edible marijuana exposure calls to poison control centers. California Poison Control reports the highest number of marijuana exposure calls are for children under the age of 5 years old. California Office of State Health Planning and Development reports emergency department visits and admissions for any related use of marijuana has increased by 120% from 2017, where there were 421, to 2019, where there's over 925 for the ages of 0 to 5 years old. Here to discuss local exposure numbers is Dr. Natalie Laub with Rady Children's Hospital. Doctor?
Good morning, everyone. Thank you so much for inviting me to be here today. So I'm a pediatrician at Rady Children's Hospital. I'm going to share with you some of the alarming trends that we are seeing in very young children. Since 2016, we've also seen a dramatic increase in the amount of children, young children, who are ingesting cannabis products. Now, the average age of child that we see who accidentally eats a cannabis product is 2 years old. So we're talking about toddlers. If you look at the graph here to my right, you can see the increase. You can see how high the numbers are going, where we started and where we're heading. So why is this concerning to us as pediatricians and as frontline clinicians? Cannabis products are making young children very sick. When a 2-year-old ingests cannabis, they can lose consciousness, they can have altered mental status, they can have seizures. Greater than 50% of young children who accidentally eat a cannabis product have to be admitted to the emergency room, and many of them go to the intensive care unit. So where are children getting these products? What we've seen in our data is that children are getting these products in their homes. The most common user of a cannabis product, specifically edibles, is parents, moms and dads, using cannabis products. 75% of children who eat a cannabis product have eaten it in the form of candy, a gummy, something that looks like everyday food. So what is the message that we want to get to parents and families and people who take care of children? Cannabis products are common. Cannabis products are in households. And cannabis products look like candy. And children love candy. I've never met a toddler who can only eat one gummy bear, one cookie, or one mint, or one piece of anything. And so cannabis products should be treated like any other medication that you would lock away from your child. They should be kept up high. They should be kept in lock boxes. If the product is colorful and looks like something a child would want to eat, it should be covered, right? It shouldn't be alluring to that child. They shouldn't be out there looking for it. So keeping your cannabis products high up, locked away, and covered is one way to prevent accidental ingestions. Now, if your child has eaten a cannabis product that's in your home, it is crucial they receive emergency medical attention. So if you start to see your child have symptoms, altered mental status, not waking up, significant vomiting, or seizures, it is important to call 911 and have your child receive medical attention. Another thing that we are seeing in our data is it's very important as a parent or a caregiver that you tell your medical provider if you think your child has eaten a cannabis product. This is important because what we know is that unnecessary testing is being done on children when providers do not know they have eaten cannabis. So to prevent unnecessary testing, if you're concerned that your child has eaten a cannabis product, please tell your frontline clinician, your pediatrician, or provider who's treating your child. That way your child can get the best care possible. Thank you.
Good morning, everyone. I'm very appreciative for the speakers today. This is a very important issue. My name is Joe Eberstein. I'm with the San Diego County Marijuana Prevention Initiative and the Center for Community Research. I'd like to offer some local statistics, if I can, pertaining to San Diego exposure cases. San Diego County has seen a 75% increase in marijuana exposure cases handled by California Poison Control since 2016 legalization. California ruled that cannabis edibles should not exceed 10 milligrams of THC per serving, and packages of edibles must have no more than 100 milligrams of THC. Marijuana retailers can sell up to 500 milligrams of THC a day. The problem is a child doesn't know what a milligram is. Children are drawn to brightly colored, sweet-tasting candies and may consume more than one at a time. Some helpful tips for parents, caregivers, and babysitters. If you're watching young kids, keep products out of the reach of children in a resealable bag. If you have these products in the home, consider storing the product under lock and key. Take account of how many candies are in the bag. Never leave products out of the bag laying in an area accessible to children. If you suspect exposure, call 911 or go to the local ER, and please either bring the package the edibles were in to the hospital or take a picture of the label so the medical staff know what the product contained. There are a lot of other chemicals out there other than THC, like Delta-8, THCP, that we really know nothing about. Also call Poison Control at 800-222-1222 so you can document the case of poisoning as we track this. Be honest with the medical staff on the products you have in the home. And I want to thank everybody and our partners at HIDTA and Rady and Sandag. And if you have any questions, we will take them after the event. Thank you for coming.